Okay, welcome. My name is Carly Pippitt. I am a family physician. In addition to my primary care practice within the university, I also see patients in our headache clinic here at the University of Utah, which I've been doing in addition to my primary care probably for about 5 years at this point. We're going to be relatively informal since it's you and I and whoever else is with us online. And today we're going to talk about how to make the most out of your visit with a primary care provider in regards to headache. So please feel free to ask any questions you have as you go along or anything that comes up. So the first thing that I would say is it's really important, as a primary care clinician, it's not uncommon for people to come in with multiple things to address. So maybe you're there for your physical and you need a refill of your chronic medications for whatever condition you have, and you have a question about a mole. Oh, and by the way, I'm also having headaches. So the first thing I would say is make an appointment for just your headaches. It's an important enough condition that I would say it warrants its own visit. Sometimes we're good as primary care about suggesting that you make your own visit, and other times we're trying to get as much accomplished as we can in a visit for you. So be an advocate for yourself and ask that you make a visit just for that, or you schedule and make just for that. And then when you come ready. So know all about your headaches. So most people do not have just one type of headache. So think about, is it either separating them out by symptoms or by numbers? So maybe you're like, headache number 1 is this low-level headache that I have every single day that I wake up with in the morning. Doesn't usually get very bad, but I have it most days of the week. And then maybe headache number 2 is the one that I would call a migraine, that hurts really bad. The pain is more on one side than the other. The bright lights bother me. And then before it all starts, I get this funny shimmering in my vision, and that's how I know that it's gonna happen. So come with all of those. So kind of outlined. I will say sometimes in primary care we're maybe not as good about asking tell me about all your headache types. We just want to know, we'll just use that term sort of largely headache or migraine and use them interchangeably. So think about a way to separate them that makes sense for you. Most of us are pretty happy to go with whatever language works for you. And to that end, I'd bring in a diary. So at least a month of what's been going on with your headaches, probably better to do even more than that, about 3 months. So there, you can do this on a calendar, you can do this on an app. You have a lot of different options. I would say whatever is gonna make it most useful and easy for you, that's what's gonna matter. And then bring it in. This might not be something that your provider is gonna ask for, but is a way for you to sort of demonstrate what's going on and give a better sort of objective number to it more than anything else. Sometimes I think headaches can be a little frustrating for both patients and providers because there's not a lot of oh, your blood pressure is 120/80, and we have this hard number that we can measure, whereas headaches, it's just how do you feel, and you tell me. So if you bring in this calendar for 3 months and you're look, I've had headaches 80 days out of the last 90, that's just another way to sort of quantify.
Okay, is that what, so I've been seeing a headache doctor, or migraine. I call mine migraines. I've had them my entire life, ever since I was little. And a friend of mine remembers me in high school going to the nurse, and people would, people and my teachers would always say, oh, you're having another headache. They just didn't understand. And anyway, it's a big, long, drawn-out story. But would you recommend, with the diaries, just how many headaches you have? Because that's what I have been working with Dr. Henry. Yeah.
So the question is about, just for the people online, if you can't hear, for your headache diary, how do you decide what to put in there and what not? So same with when you come in with the history, if you're so there's this daily headache, there's this other headache where the lights bother me, and then there's these really bad ones where I vomit, and maybe you call them headaches 1, 2, and 3, but you know what the descriptions of those are. Put all of those in there. So you want to think of that as being your most complete sort of diary of all your headaches that happen. But that's a very good question. Is it bad enough to go in the diary? The answer is yes. Every one of your headaches should go in the diary. And you're right, tend to throw around the words headache and migraine sometimes synonymously, and those are not necessarily synonymous. So I usually try to use whatever language you're using. Sometimes I will if people don't think that maybe their headaches are bad enough to qualify as a migraine. If they really do, then sometimes I'll say, you know, because I think in a lot of people's mind, there's like headache and then there's migraine. It feels like this big escalation. Let people know, like, no, this really is a migraine. And sometimes that's important for providers to hear, because if you tell me that you're having a migraine, I might think differently about how to treat you as opposed to, is it a headache? So that's why it's good to just give all those details and sort of that full picture, so then your provider can decide. Okay. So some of these, like, I mean, I have people come in with names like, this is the, you know, wham doozy headache, or like, it's whatever you want to say. And I sometimes will suggest that you either describe them by the symptoms or like descriptors. So the thing I'm thinking about the most here is aura. So aura has so aura has a very specific definition in medicine, and that can sometimes get tossed around. It has some implications, so I won't usually ask patients, now tell me, do you have an aura? I'll usually say, now tell me, do you have any symptoms, like any funny spots, dots, squiggles in your vision, numbness in your hands, or something that happens before you get the head pain, or lets you know you're always gonna get a headache afterwards? That's usually the question that I'll sort of ask. And if someone tells me, oh, I have an aura, I'll say, tell me what you mean by that. Not because I don't believe you, but I just wanna make sure that we're both using the words in the same way when we talk about that. No, and so in that diary, other things I would include are your medications. So what do you take? So maybe for that.
Mm-hmm. And I saw that study, and I'm happy to say that I used to take exercise Sertraline, and I would take probably up to 16 a day, which was terrible. My dad was a surgeon, and he knew Dr. Henry, and that's how we got all, but anyway, I luckily got off that.
Yeah.
But well, Dr. Henry, he got me on some other things. I take amitriptyline. I think that's
correct.
And then his physician's assistant, Ruth, put me on, now I don't even have, it's that
Topamax or topiramate.
Yes.
Yeah.
And that's an anti-seizure, right?
Correct.
So is that something that's commonly used?
Very commonly used. Okay. Yeah, absolutely. So you've done a good job sort of leading into one thing I think about with medicines is that we use medicines in two different ways. So we use medicines for prevention. So those two that you just named, the amitriptyline and the Topamax or topiramate, those are ones that you take every day to try to prevent.
Morning and night.
Yep. So to try to just at night, yeah.
But the other I take in the morning.
Yeah, so you take those to prevent having a migraine, and then there are other medications that will give you for rescue treatment. So those are the ones you take when you get a headache.
My rescue ones, I take rizatriptan. And then I just take the over-the-counter Aleve.
Yep.
And then that anti-nausea, it's that ondansetron.
Yeah, absolutely. So you've done a great job of highlighting all the medications options. So not only prescription, so thinking about prescription for pain, so you talked about the rizatriptan or the Maxalt, the prescription for nausea, sometimes we don't think about that as something else you're taking, but that ondansetron or Zofran, and then including over-the-counter medicines, so the Aleve. So sometimes maybe for like a less severe headache, you might decide to take the Aleve, but then for a more severe headache, you might decide to take your prescription medicine, and all of those are important. So headache diaries will usually have information in them like, tell us what happened with the headache. Like, did you wake up with it? How long did it last? How much had you slept the night before? Had you been active? Was it a particularly stressful day? Had you eaten something, that maybe was a trigger? And even things like the day of the week. So it's not uncommon for some people to do fine during the week and always get a headache on Saturday or Sunday. or maybe do great, and then Monday, Tuesday, when you go back to work, you get a headache. So the calendar is diary is a pretty rich source of a lot of different information, but it's pretty dependent on what is it that you put into it. So it might feel like overkill, like you're putting a lot of information into it. For women, including things like when your menstrual cycle happens, those are all important things that can trigger a migraine for some people. So very helpful information to include. I'm not always very good about asking for it. So, when people come in with their hand, it can still be helpful to revisit even when you feel like people are pretty well controlled. If there's a change, I think always going back to that can be a helpful thing to revisit.
Right. Well, and I have problems with depression. And so I do take, it's the generic, it starts with an S. It's, I don't even know what it's called.
Sertraline or citalopram?
It's for, it's like a very common thing. But I take it in the morning, and I've had a lot of depression, but then I got very depressed with the headaches because I've had them all my life, and I just would have loved to find something like this that would help. And my mom would have too, and my dad too, but especially my mom, because it was just interrupted school. And so then when with Dr. Henry and Ruth, they gave me those injections, and they worked great. And I thought, this is the best, and my mom would have loved it. And anyway, I had two reactions. I had a reaction where I had to go down in the ambulance, and then I had another reaction, and so I can't get them anymore.
Oh.
So that was very difficult.
That is disappointing.
I had a hard time with that, but so they gave me some other suggestions, like a band. Would you ever suggest?
That's a pretty new thing. So I will tell you, I've seen it. I haven't prescribed it for anyone, but is a new kind of option for treating pain. It's a funny thing to say, but it's kind of a good time, an interesting time to have migraine, because there's so many new options coming down that are things we haven't had for a really long time.
My brother-in-law is a neonatologist, and it's hard for me to talk about these, and I was telling my sister, and actually he thought, why don't you just maybe mix it up a little bit and see somebody, I think in your department. So I don't know, I'll get a name, but he said maybe just check something out too and see if that works. But
So
I'll see who suggested, but continue with Dr. Henry and Ruth. But that was hard when they said I couldn't get those, and she had me come up and get some IV fluids, but it just didn't.
Still didn't do it.
It just didn't, and they were, they're so great, but that particularly, and so anyway.
Well, we want to try to keep you safe. I mean, no medicine, unfortunately, it was without risk or without side effects.
Yes.
So always trying to balance helping you feel better, but not making things get worse.
I know that they were really worried when I had that, because I couldn't swallow and different things. So I know that there's a reason why.
Yeah, that's really scary.
I was ready, and I told my sister, I'm ready to sign a waiver.
Because it was what finally made you feel.
I just as soon, and I think that I just as soon go out than have to have these, that they're that debilitating.
Yeah, and that's something that, sometimes if people who've never had a migraine before, I think it can be a difficult conversation to really get your provider or someone to understand sort of the intensity and how much things can affect your life. So that's another way that diary can really be helpful to say, I had to go home from work this day. I had to, cancel date night with my partner. I couldn't do these things with the kids, like really trying to show what an impact this has. Right. And then that diary can also be helpful, I think, for patients too, when we look as we're doing treatment and you're like, oh, look at how bad things were actually before, and you had 85 days out of 90 that had a migraine, and now we're down to 30. So yeah, that's still a lot. That's still too many. Let's see if we can do something, but it's much better than where you were before.
Right.
So talking about your family, you brought up sometimes one of our colleagues will talk about the 5 histories of headache. So family history, you bring that up with your mom and your dad. Very common for people to have a family history of migraine, and good to sort of know that. Sometimes nice to know if there was a certain medicine that worked well for them.
Yeah, and I don't think, neither one of them had headaches, but I have a feeling that my maternal grandmother did. Just from what they said, she always had to have the lights, always had to have a dark room.
Yes.
And she was sick with other things, but I think that she possibly could have had it.
And sometimes people, you're absolutely right, won't call them migraines, but they'll talk about, oh, she had to go lay down, he had to go lay down, here's what was going on. We talked about medication, so knowing what meds you've been on in the past, things that have helped, not helped, your own.
Sounds like you agree with those.
Oh yeah, absolutely. Those are great choices, and ones we use very commonly. Your own past medical history, so you talked about, a history of depression. There are some medicines that work very well for both depression and migraines. There are some medicines we use for migraines that might actually make depression worse. So always helpful to put your treatment choices in the context of whatever else is going on in your life. And then, just your history of what is the very worst history of your headache? What is the history of your headaches over your life? So not uncommon for women to say, as they hit puberty, that's when their migraines got really bad, got worse in their 20s, 30s, and then maybe got a little bit better after menopause. Not always the case, but something like that, sort of what's the temporality of all of this as you've gone through your life. Helpful things to sort of keep in mind. So I think those are some of the biggest things I really wanted to talk about. Really making sure you had your own appointment, know your medicines, the dose, the length, and then all the sort of different types of headache that go along. We talked about sometimes the number aspect of things maybe not being as rewarding, but I think that's where the diary can be really beneficial and really helpful to get people to know. And even for me as a primary care provider, I think it's great when I get to know the whole family. I know you in the context of all of your medical conditions. Sometimes it's a little hard for me here in Headache Clinic to separate myself from the primary care part of my life and not want to take care of some of your more primary care issues, because that's sort of where my heart is. That's what my training is in. But just trying to see patients here to increase our access for new patients with Headache Clinic, because we get so many referrals. It's a great way to increase my own skill set and to serve our patients a little bit better.
Okay.
Other questions or anything I can answer for you?
I don't think so. I appreciate.
Yeah, my pleasure. How about any questions from our online audience?
There's no one left.
Okay, good. I have a bad habit of being very brief and to the point, which is good and bad, but I'm like, I don't really know what, happy to answer any other questions or anything else you might have.
I had a brain tumor quite a while ago, and I was hoping that would take care of it, but it didn't.
I think that's one of the most frustrating things, is that we know that migraines are mostly from family history and then, life external stressors. So are you not sleeping well? Are you dehydrated? Are you, not being physically active? All of those things sort of play into it. But the unfortunate nature is there is no, magic potion, magic wand or thing that's going to make you never have one again. But how can we either make you have less migraines or make you have them be less intense so that you can still do the things you want to do, still be able to live your life?
Right. Well, when I was taking that extra strength, etc., they were so bad at that time that people could tell by my eyes, and I would have to lay down, and then after about an hour it was fine. And it were just terrible, and so I would take so much of it. But then when I got off of that with the other, I'd have them every single day.
Yeah.
Multiple times, but then I got off of it, and it's much better. I don't have them every.
And not uncommon, unfortunately, for people to get into the exact situation that you described, where you're taking Excedrin and then you're taking it more often and then you're taking it more often, and not just Excedrin, can happen even with things like the rizatriptan, with ibuprofen, with aspirin, where you're like, well, I feel an inkling, maybe, and it's going to work, so you take it.
Yes.
And so that's how you get yourself into kind of that vicious cycle, and you shouldn't feel bad about it, because you're just doing the thing that makes you feel better. It's not a very well-known or unfortunately super well-understood entity, which is why we're doing that. We're part of that study from the Mayo Clinic to try to decide what is the best treatment option when you get into that sort of cycle.
Okay.
Mm-hmm.
Yeah, they're just, they can be hard. You see a lot of people with them.
Mm-hmm. Absolutely. Mm-hmm. But like I said, kind of a nicer time to have migraines now than I probably would have said in the last 5 years, just because we've had so many new drugs released on the market and more drugs that are specifically targeted toward migraine. So not things like you were talking about, the Topamax, which is for seizures, or the amitriptyline, which is actually a really old antidepressant that we use for sleep and for pain. So we're sort of using drugs that had another intended purpose, but the side effects are sort of, if you will, the side effects are helpful for what we need.
Right.
So nice to have new drugs that are specific for migraine. So.
Right. Why, because I've asked Ruth why the anti-seizure one worked.
Mm-hmm.
And she said it's like a lot of, I can, like the nerves are.
Yeah, we'll kind of talk about quieting down all the nerves or things that are going on. I don't really like to use the word like inflammation because it's not really that, but just kind of quieting or settle things down. So sometimes when that pain gets so escalated, you know, you might find that a glass of red wine is not normally the thing that gives you a migraine, but if you're kind of in that state where everything's sort of ramped up, then maybe things that don't usually bother you, you can't actually do. So you're just trying to settle stuff back down. Mm-hmm. Sometimes I'll talk about the, this is spinal tap, where everything's dialed up to 11. We're just trying to like ramp you back down to more that like lower level where not every little thing kind of bothers you or sets you off.
Okay.
Mm-hmm.
That's good. Okay.
But it sounds like Dr. Henry and Ruth have done some really great things for you.
I really, really
Mm-hmm.
like them a lot.
That's great.
I do.
Mm-hmm.
They've been great.
Mm-hmm.
And I know they have a real passion to.
Absolutely, absolutely. And I would say the same is true for all of us in the headache clinic too. I think to do this work, you have to have a passion for it and know that you can help people feel better and see a difference. Absolutely.
I think so too.
Mm-hmm.
I so appreciate it because I've had them for ever.
Mm-hmm.
That's why I think
Mm-hmm.
I know my parents would have really liked.
Yeah.
Would have been really happy.
Well, it's nice to hear, you know, that you can go see someone and you can say, yeah, I have this, you know, I feel like there's a worm crawling around in my head, or say something that feels sort of crazy, that you don't feel like you would normally share with your provider, and they would just look at you like, oh yeah, okay, go on, tell me more, not like, you know, give you a sort of like.
I call them all the headache club.
Mm-hmm.
Say yes. And I think it was just because those shots that didn't work, I was just so desperate to get something else. But Ruth had told me about that band, and she said, you know, it's helped some people. But I thought, if somebody gave me a little pill and said, this will help, I think I'd just do about anything.
I think that's hard too, because a lot of things are sort of trial and error. So you have to try them. Sometimes, you know, we'll even talk about going back to something that you tried before that maybe worked a little bit, but not much, because things could be different when you try it again. That can be a little hard to convince people of sometimes, but if you knew it helped a little bit in the past, it can definitely be worth trying again. Or if there's a compelling reason to think about trying it again, that can definitely be helpful.
Yes.
Mm-hmm.
So
Well, great. Well, I'm glad to hear you're in such good hands.
yeah, so
Mm-hmm.
I thought I just need to try everything that they've said. So
Yeah.
that's why I let that come in here. Might be good.
Yeah. Well, great. Nobody online still?
No.
Okay. Are you going to stick around for yoga, or are you just here for this?
Oh, I'm here for anything that would help. But it sounds like maybe I didn't know if they'd cancel it because of that.
Yeah. We had a
That
discussion.
stuff is a
Yeah.
bad thing, isn't it?
We had a discussion about it, but felt like we weren't typically here, you know, in a big group of gathering, and we've got our social distancing here, right, with at least 6 feet. And we usually have, sometimes not a live online audience, but people who will watch this later. And so felt like was probably still a reasonable thing to do. And always a better session when we can have a conversation as opposed
I really
to
appreciate it.
randomly talking to a camera.
Yeah, I really appreciate it. My sister, and the only reason why they thought, you know, just maybe go and try something, you know, just anything that would help.
Yeah.
But
Mhm.
yeah, I think, And it sounds like Ruth and Dr. Henry have me on the right thing.
Yeah.
Would you recommend just staying with them then?
I mean, I think always sort of up to you. I think if you feel like you're making progress, I think in terms of even with a headache provider or with primary care, I think you should feel like you're with someone that you trust, that you
really trust them.
that you're making progress. I think sometimes a second opinion can be nice, maybe to get the same message from a different person. Like if that's the reassurance you need, that might be helpful. But there's nothing you've said that raises any alarm for me.
Yeah, because I think they're really, I do really enjoy them.
And sounds like you can be honest with them and let them know your concerns and what's going on. And
Yeah, I have talked to Ruth, and she just, she's gone over all the things of what, because I've asked them what else we can do other than those
injections.
Injections. And so I'll just keep doing what they say.
Great. Well, good. And who knows, you might check out some of our old videos online and see if some about the medicines are really helpful for you or something like that.
I really thank you very,
You're so
very much for
welcome.
coming here. That was
Yeah. Thank you for coming.
great. Yeah.